Hello and welcome everyone to the World Future Council's World Health Day webinar, From Children's Health to Public Health and Universal Health Coverage. This webinar is part of the Forward Thinkers webinar series organized by the World Future Council. This webinar is also live streamed on the Facebook page of the World Future Council. I'm your moderator, Hannah Hundle, representing Youth Present, the Youth Forum of the World Future Council, and I'm thrilled that all of you could join us today for our session covering children's health, public health, universal health coverage, and everything in between, held on the occasion of World Health Day, which was yesterday on April 7th. As we know, the COVID-19 pandemic has been devastating, but importantly, that devastation has been felt differently by various populations around the globe. The pandemic has reminded us of the need to re-examine our assumptions around healthcare access, reassert healthcare access as a human right, and remove the deep inequities that limit quality care for so many. There's no better time to unpack these issues than now. In the words of the World Health Organization, this year's World Health Day is dedicated to, quote, building a fairer, healthier world, because some people are able to live healthier lives and have better access to health services than others, entirely due to the conditions in which they are born, grow, live, work, and age. All over the world, some groups struggle to make ends meet with little daily income, have poor housing conditions, and have little or no access to safe environments, clean water and air, food security, and other health services. This leads to unnecessary suffering, avoidable illness, and premature death. And it harms our societies and economies. Health inequities are not only unjust and unfair, but they also threaten the advances made to date and have the potential to widen rather than narrow equity gaps. However, health inequities are preventable with strategies that place greater attention to improving health equity, especially for the most vulnerable and marginalized groups. COVID-19 has hit all countries hard, but its impact has been harshest on those communities which are already vulnerable, and they are more likely to experience adverse consequences as a result of measures implemented to contain the pandemic. Those were some words from the World Health Organization, and our webinar will highlight the significant role of health in our everyday lives and the health risks that exist because of COVID-19, but also beyond, such as because of chemicals that disrupt our hormone systems and pollution. This is also the topic of this year's Future Policy Award, which centers around protection against chemicals that are known hazards to human health. Before diving into today's discussion, I want to briefly turn the microphone over to Alexandra Wandel, the chair of the Management Board of the World Future Council, to introduce the 2021 Future Policy Award. Alexandra, the floor is yours.
I would like to welcome you all, and I would like to start with a little PowerPoint presentation about the World Future Council, which is hosting this webinar. So just to explain to you, World Future Council really envisions a healthy, sustainable planet with just and peaceful societies. And we want to achieve this by identifying, highlighting, and spreading future just policy solutions for current challenges humanity is facing. And we have a global council that is composed of 50 eminent members. They come from all walks of life and also from governments, parliaments, civil society, academia, and the arts and business. And today we have one of our distinct members, Maria Fernandez-Espinosa, with us. And our counselors are representing us on an international level. And we have a special award which we created in the year 2009. And this is the first award, which is also known as the Oscar for Best Policies. And this award is celebrating policies rather than persons. And the aim is really to identify every year one topic that is of particular urgency. And then the aim of the award is to raise global awareness on the topic, but also to highlight and celebrate really impactful policies that current and future generations are benefiting from. So we want to highlight that sustainable policies exist And we have done this on a number of issues, including also on the rights of children and other topics. And our council has decided that the topic for this year is protection from hazardous chemicals. And you see that we have also some very strong international partners. So we also have the strategic approach to international chemicals management, or UNEP, UNDP, OECD, ILO, UNITAR, and we are happy also to have the support of the Federal Ministry for the Environment, Nature Conservation and Nuclear Safety of Germany, as well as of their Federal Environment Agency. So why did our council decide that protection of hazardous chemicals should be chosen as a topic for this year's award? It is because there are so many chemicals that are toxic and that can actually cause irreversible harms. We also know that particularly children are impacted by this, and that many of them are born already pre-polluted when they are born. And we also see a dramatic number of deaths and also illnesses. And because we know that the chemical production capacity will actually double by 2030, it is very important to also look into regulatory and existing policies that can protect children, people, and the environment from these chemicals. So we have looked for policies, laws, and legal frameworks, and we have had several categories that we have looked into for the award this year. On the one hand, protection from chemicals across the life cycle, also highly hazardous pesticides, lead in paint, policies to tackle child labor dealing with hazardous chemicals, environmentally persistent pharmaceutical pollutants, and chemicals and plastics. So these were the categories that we called for in the call for nominations. And we also made it clear that the policies need to be in force already for 2 years. This is in order to check that there's also an effective implementation, because we need to see that there are real improvements and empirical data available, and also that the policy is actually replicable, because we want to award the policies that can be spread to other countries and regions, and that also are in line with the 7 future just lawmaking principles. So you see, we have actually reached out to 40,000 international experts worldwide, and we received in the end 55 nominations from 36 countries. We then had a thorough evaluation of the policies, looking into the impact, the transferability, and whether the 7 principles of future just lawmaking are applied. These are principles that the International Law Association has developed. And then we actually had an international jury that with experts from the international level and from different continents around the world. And they actually have reviewed the evaluation report and made their choice about the award-winning policies. So this is a short overview about the award. So thank you very much. And with this, I hand over back to Hannah.
Thank you. Thank you very much, Alexandra. As you can tell, everyone, our Future Policy Award 2021, which deals with hazardous chemicals, has a strong focus on protecting public health and children's health in particular, as Alexandra outlined. To understand more about this, in the next 1.5 hours, we will be hearing from a stellar panel. The panel today includes Dr. Leo Trisande, Professor of Pediatrics at NYU Langone, who will be speaking about health hazards of endocrine disrupting chemicals to children and corresponding policy solutions. Our speakers will also include Bashkut Tunjak, former UN Special Rapporteur on Toxics and Human Rights, who will speak about the impacts of toxics on children's rights and about measures of prevention before it's too late. We will then hear from Maria Fernanda Espinosa, who presided over the 73rd General Assembly of the United Nations and is a counselor at the World Future Council, who will speak about health as a public good and universal health coverage. So thank you to all of our distinguished panelists for accepting our invitation and making the time to speak with us today. But first, in the spirit of the Future Policy Award and today's webinar theme, we're going to now shift to watching a very brief video about emerging policy issues from the strategic approach to international chemicals management. And we'll begin that video right now. And as always, please raise your hands or use the chat feature in Zoom to put in your Q&As. Thank you.
Have you ever noticed how many chemicals shape people's daily lives? They keep homes sparkling clean, boost food production, and are included in virtually all manufactured goods surrounding you right now. Chemicals drive the economy, but as we produce more than ever before, they have to deliver their benefits without damaging our health and environment. Toxic lead paint, for example, is still used in many regions of the world, and highly hazardous pesticides continue to poison agricultural workers and contaminate the environment. Better understanding of such hazards led governments to create stricter regulations for handling toxic chemicals, and many industries replaced them with safer alternatives that were just as effective. Unfortunately, not all people have benefited from this development, and in particular, people in the global south remain exposed to hazardous substances that have long been banned elsewhere. We also face new challenges in keeping our world safe from chemicals found in products. Workers who assemble and recycle the vast numbers of electronic devices, for example, often suffer from exposure to toxic fumes. And everyday products, such as toys and clothes, contain a complex array of chemical compounds, some of which are endocrine-disrupting chemicals that interfere with the normal development of living organisms by disrupting our hormonal systems. Consumers now increasingly demand information on the chemical safety of the products they are buying. There are also many compounds with long-term effects we don't yet fully understand, like the tiny particles used in nanotechnology, highly persistent perfluorinated chemicals, like, for example, from non-stick coating in frying pans, and the residues of pharmaceuticals released by households, livestock production, and drug manufacturing. The strategic approach to international chemicals management, called SICAM, is the international policy framework on chemical safety administered by United Nations Environment. SICAM serves the 2030 Agenda for Sustainable Development in fighting poverty and protecting our planet. Although chemicals are used locally, global cooperation among governments and industry is crucial for their environmentally sound management. SICAM has been guiding this unique global dialogue since 2006. It spotlights emerging policy issues and issues of concern, and unites governments, industry, and civil society to agree on priorities for cooperative action. This framework supports policymakers in adopting adequate legislation so that eventually chemicals serve our well-being without compromise. SICAM, working towards a chemical-safe world together.
Thank you. That was a fantastic introduction to a complex topic. And now that we've laid sufficient background for today's discussion, it's time to turn to our stellar panelists who will lead it. So given the background that Alexander just gave us on this year's Future Policy Award topic, we're going to turn our discussion first to Leo to get a better sense of chemical hazards and corresponding policy solutions. Leo is an internationally renowned leader in children's environmental health. His research focuses on identifying the role of environmental exposures in childhood obesity and cardiovascular risks, and documenting the economic costs for policymakers for failing to prevent diseases of environmental origin in children proactively. Leo is perhaps best known for a series of studies published in Lancet Diabetes and Endocrinology and the Journal of Clinical Endocrinology and Metabolism that document disease costs due to endocrine disrupting chemicals in the US and Europe of $340 billion and 163 billion pounds annually, respectively. After receiving his bachelor, medical, and public policy degrees from Harvard, Leo completed the Boston Combined Residency in Pediatrics and a legislative fellowship in the office of Senator Hillary Rodham Clinton. Prior to coming to NYU, he completed fellowship training in environmental pediatrics. We are very pleased to have you on the panel, Leo. You are an expert on the health impacts of endocrine disrupting chemicals, which, today's topic in colloquial terms might be referred to as toxic or hazardous chemicals. And since we're surrounded by chemicals everywhere, why don't you start, Leo, by laying a foundation for us of what is specifically meant by the colloquial term toxic chemicals, and what do the health impacts of these chemicals look like on a mass scale? And perhaps you can also give us some insight on the corresponding economic effects of exposure to these chemicals, especially in vulnerable communities. The floor is yours, Leo.
I'm delighted, Henna. Thank you very much. I think the video laid a substantial amount of the groundwork. Let me build on it by going back to thinking about when I started as a medical student in the 1990s. We knew a bit about lead, we knew a bit about air pollution, but generally speaking, we had some false assumptions about the effects of chemicals on human health. We thought, like Paracelsus, the 1500s Swiss philosopher, everything is a poison, only the dose makes the thing a poison. Unfortunately, that was a fatally flawed assumption in many cases. We have increasing evidence, in particular, that little things matter, that low dose exposure to a variety of synthetic chemicals in our environment can have broad and widespread consequences across the lifespan. The other flawed assumption was that there were only a few mistake chemicals that really cause problems. In particular, this assumption has been exposed as flawed for the effects on hormones in our bodies. Now, let me just boil it down to simple lay terms. Hormones are our basic signaling molecules. When you think about that, that's practically every biological function you can think of at some level. It's not quite that, but it's salt, sugar, even sex, metabolism, maintaining a healthy body temperature are all mediated by hormone functions. And when you think about natural molecules, these hormones, what happens with endocrine disrupting chemicals that are synthetic chemicals, they're not designed with hormones in mind. And so through a variety of mechanisms, they scramble those molecular signals and thereby contribute to disease and disability. What little we know suggests at least 1,000 synthetic chemicals scramble those molecular functions. The evidence is strongest for 5 categories of chemicals, which span a broad array of uses. Flame retardants used in electronics and furniture, pesticides used in agriculture, phthalates used in personal care products, cosmetics, even food packaging, bisphenols used in aluminum can linings and thermal paper receipts, and what was hinted at in the presentation, perfluoroalkyl substances, or what we now call forever chemicals, a bit of a misnomer, but these are non-stick chemicals used in pans, in oil and water resistant clothing, and a host of uses. So I don't have the time to go through all of the effects. The effects are strongest in particular for the effects of developing brains of children. In particular, these chemicals mess with thyroid hormone, which is a crucial growth factor, particularly in pregnancy, as well as in the earliest phases of life. And again, this is where this little things matter adage really comes into play. Is at the lowest dose, minute amounts of chemicals that we find in these pre-polluted babies, where not only is thyroid hormone disrupted because the baby's relying on mom's thyroid hormone, that insufficient thyroid function has implications that are permanent and lifelong for a child's ability to think creatively and contribute as a member of society. We're talking about IQ points, which seems a bit of a minor issue at some level. What's an IQ point at some level? So what I respond to with that is if a child loses an IQ point, maybe mom doesn't notice, child might not even notice, parent, teacher might not notice, doctor might not notice, but if 100,000 children lose an IQ point, the entire economy notices, because each IQ point is roughly worth 2% of a child's lifetime economic productivity. And if on average a child makes $1 million of economic productivity over his or her lifetime, we're talking about $20,000. Multiply that, apologies for being American-centric, across 4 million kids born each year, you're talking about billions of dollars, large costs to society. And when you add up costs about these chemicals contributing, for example, to obesity, we know of 50 chemical obesogens literally making us fatter. Nothing that I'm going to say, by the way, about obesogens undermines the importance of diet and physical activity, by the way. Just to use PFAS as an example, they are known to actually slow the body's resting metabolic rate. In populations who've already successfully lost weight through healthy diet and physical activity, the levels of PFAS measured at that time that they successfully lost that weight were related to weight regain, because their body's resting metabolic rate was slowed down. We're also talking about certain cancers, reproductive conditions. We've seen infertility substantially on the rise, substantial declines in sperm count. But that gives you a sense of the broad human health impact. So this is a life or death matter in some cases. And that is, I'm not being too wild in saying that. Phthalates, for example, the plasticizing chemicals have been associated with the death of 10,000 adult men in the US each year. And that's because phthalates reduce testosterone, and low T is either a marker for or predictor of adult cardiovascular disease and stroke, literally killing people each year. So there are also broader social costs, and as the presentation described in the video, money talks. And ultimately, we've done a series of studies, as you alluded to, documenting that endocrine disrupting chemicals cost $340 billion, that's billion with a B, 2.3% of our gross domestic product in the US each year, and 163 billion euro, 1.2% in Europe. Now, that difference is big. And that's actually an important point, because policies predict exposures, exposures contribute to disease, and disease ultimately costs our economy. When you look at the fine-grained contributors of those costs, flame retardants in the US are the biggest reason why we actually have much more costs than Europe. And that's because in the United States, we required flame retardants to be put into every piece of electronics and furniture since the 1970s, due to a law, this is scary to say, from California that required this to be added. So we've had a generation of American kids where they've had flame retardants in their bloodstream when they're born, compared to Europe, which didn't require it and actually banned it much sooner. Now, the story is not all great for Europe either. With pesticides, the story is flipped around, where pesticide exposures are actually higher for certain types, the organophosphates, because the US required an additional safety factor for children for pesticides in agriculture due to the Food Quality Protection Act. So those cost differences, I can get into the numbers, but the bottom line is there are two contrasting narratives that reinforce the impact of policy on human health and our economy. Similarly, we talked about lead exposure. Back in the 1970s, when I was running around this city of New York as a kid growing up, I had an average lead level. I actually don't know my lead level. The average lead level in children was 15 microgram per deciliter. The kids I teach at NYU, I call them kids, I'll apologize, average was 1 to 2 microgram per deciliter. That equates to a 4 to 7 IQ point impact in each and every child. And we still get a $200 billion economic stimulus package by reducing and eliminating lead in gasoline and paint. And that aggregates and drives home the real economic benefits of proactive action. So I'm really privileged to be here today. I see this as a wonderful opportunity to bring forward the real and substantial economic impacts of good policy that improves the lives of children in particular, but also all of us. And I look forward to the discussion.
Well, we're privileged to have you here today, Leo, and thank you so much for laying that groundwork. So shifting to solutions, what are some of the policy frameworks either deployed in Europe or in the US or in other parts of the world that you believe can really help mitigate not only the health, but also the economic impacts of these endocrine disrupting chemicals?
So I've already alluded to the fact that in the US in the 1970s, we did the right thing and got lead out of gasoline and paint. And actually globally, we've seen dramatic drops in lead levels in kids all across the world, in the South as well as in the North. And that's because we got lead out of gasoline. Very recently, by the way, this was a major accomplishment. Now the focus is through the Global Alliance to End Lead in Paint on getting lead out of paint globally. And that's a huge initiative It turns out getting lead out of paint doesn't change the cost of making the paint in the first place. It just changes who can profit in the manufacturing process. But we know that getting lead out of paint further steepens the decline of lead exposure in children. So that's one example, and that ultimately pays out not just for kids' lives, but for the economies of these developing countries, or industrializing countries rather, that are just trying to make the leap to the middle and high income strata as defined by the World Bank. The other area where there's substantial opportunity is shifting the paradigm about chemical safety from risk to hazard. We've assumed for a long time that exposure is really what matters. Remember what I said about medical school, that only the dose makes the poison. And similarly, it's like everything in moderation. Very good common sense notion, but for chemicals, they don't just behave, they don't behave in straight lines. They behave in curvy, linear, sometimes U-shaped functions, where you can't extrapolate from high dose experiments to low dose impacts. So we really need to fundamentally shift the paradigm and ideally regulate chemicals when we see an effect at any level of exposure, because it gets hard to extrapolate down to those low dose exposures. We've seen it with lead, we've seen it with mercury, we've seen it with flame retardants, we've seen it with pesticides. The dose just doesn't make the poison because timing and so many other factors play a role.
Mm-hmm. Wonderful. And so what do you envision as the mechanism of action for some type of global cooperation on this issue? Would you like to see, for example, an international agency for research and advocacy on endocrine disrupting chemicals?
When it comes to endocrine disrupting chemicals, we have the model available to us, and the history is quite parallel. The International Agency for Research in Cancer was established some 50 years ago, very effective organization, independent of politics, where the science can really drive the framework and the decision making to begin with. The operation needs to then be carried out by the countries individually. But by having independence of the science and review of the available literature, discussion in a open and forward-thinking format, we've seen substantial advances and bans in many cases of carcinogens. And we have a framework for thinking about when a chemical is actually identified as an endocrine disrupting chemical. So we've, in a recent paper also published in Lancet Diabetes and Endocrinology, proposed an international agency on research in endocrine disruption, which we propose would be supported out of the UN framework, ideally through the World Health Organization or some other entity that would provide that independent oversight.
Great. Well, thank you so very much, Leo, for providing a strong healthcare-oriented perspective. Your input really drives home the point of effective policies as well. So I appreciate that you highlighted what such policies need to entail. I want to remind all of our audience that you can use the Q&A feature on Zoom to input your questions, and we'll have a few moments at the end of today's panel to get your questions answered. But I want to bring in Bashkut now to the discussion, moving on from children's health to children's rights, to give us insight on the legal dimensions of what some of Leo has been talking about. Bashkut is a senior attorney with Lay Day, where he leads their international advisory practice group, providing law and policy analysis to help states, international organizations, and other actors better protect the environment, workers, and human rights. Until recently, Bashkut served as the UN Human Rights Council's special rapporteur on toxics and human rights. During his tenure, he presented novel reports to the UN General Assembly and the UN Human Rights Council on toxics as they relate to state duties and business responsibilities. Bashkut authored the first report for the UN Human Rights Council on child rights and pollution, developed principles for the protection of workers' rights from toxics, and elaborated on the duty to prevent exposure, contributing to groundbreaking UN resolutions on these topics. He has led the investigation of hundreds of cases of alleged human rights infringements from toxic exposures, including numerous fact-finding missions for the UN. We're very pleased to have you on the panel today, Bashkut. So, given the United Nations Convention on the Rights of the Child and how that treaty really lays out important guidelines for protecting children, What does that tell us about the rights of children in the context of exposure to toxic chemicals? Are children's rights to a healthy environment being actively infringed upon today?
Yeah, well, thank you, Hannah. First, I'd like to thank the organizers, the World Future Council, for the invitation to participate in this interesting and exciting dialogue. You know, it's as an international lawyer, it's almost impossible not to listen to Leo speak about endocrine disrupting chemicals and not to immediately think of the myriad of different provisions of the UN Convention on the Rights of the Child that are being directly implicated by our ongoing exposure to endocrine disrupting chemicals. You know, the UN Convention on the Rights of the Child, which happens to be one of the most widely, if not the most widely ratified global treaty that is actively monitored, where only one state is not party to it, is truly one of the most underutilized international or global environmental instruments in my view. When I was listening to Leo's presentation, I was being reminded of various provisions under that treaty, such as the right to life, one of the most fundamental of human rights, but also those that are specific to children within the context of this instrument, such as the child's right to maximum development, their right to education, speaking about those neurological or neurodevelopmental impacts, the child's right to nutritious food, to safe water, to adequate housing, and of course, the child's right to the highest attainable standard of health. In fact, the UN Convention on the Rights of the Child, among all the international human rights instruments, makes some of the clearest linkages between health and pollution in Article 24, where it discusses the right of the child to the highest attainable standard of health and the duty of states to protect that right from pollution and contamination. Now, all of these rights are also reinforced by the state's obligation to take the child's best interests into account in all actions concerning children, where it must be the primary consideration of states when they're taking administrative or policy actions. In my view, when you put all the rights that are contained in the UN Convention on the Rights of the Child together, it forms what could arguably be said as an implicit right to a healthy environment of all children. Now, these provisions are also reinforced by other procedural rights, such as the right to information, the right to participation or to be heard, and the freedom of expression, all of which together, to me, really speak to the implicit recognition within the Convention on the Rights of the Child of a child's right to a healthy environment. As I said, the Convention has very clear provisions on environmental insults or impacts on children's rights, such as contaminated water, unsafe food. But these are only a few of those provisions that can really help to articulate and reinforce the child's right to a healthy environment. One of the features of the Convention on the Rights of the Child, which is particularly useful, I think, and increasingly being used, is the ability of the UN Committee on the Rights of the Child, the monitoring arm of the Convention on the Rights of the Child, to help ensure that states are meeting their obligations through a periodic review process, which is unfortunately something that is not in place in many of the environmental agreements that deal with toxic chemicals today. Unfortunately, and quite sadly, despite having the UN Convention on the Rights of the Child, and despite its wide ratification, near universal recognition of the rights underpinning the UN Convention on the Rights of the Child, we are facing a tremendous health burden from exposure to toxic chemicals and pollution, as Leo mentioned, with the staggering figure of $350 billion per year in the US from endocrine disrupting chemicals alone. This has been referred to by pediatricians and others as a silent pandemic, where children, as was mentioned, are being born pre-polluted, which in my view is in fact a infringement of human rights, of many human rights, not just children's rights, but across different instruments beyond the Convention on the Rights of the Child. In general, I could say that we have all been victims to some degree of such a violation or an infringement. But it's very clear that those who are living in poverty or those who are within marginalized communities have borne and continue to bear an unequal burden of the impacts of these exposures, which are linked and driven largely by unchecked consumption and production around the world.
Mm-hmm. Yeah, well, thank you so much for that background. Just really quickly, how do you envision we can move away from a justice model that emphasizes mitigation and holding perpetrators accountable, and maybe towards one that focuses really on prevention?
Well, I think we can look at some of the examples that Leo alluded to, and also look more towards the features of regulations that have helped to drive innovation towards the development and adoption of safer chemicals. We've seen, for example, in the European context, that certain regulations have been able to not only give strong signals to innovators to develop safer alternatives, but then to also create the conditions whereby those chemicals can then be pulled into the market, replacing entrenched alternatives that have built up tremendous economies of scale over decades of inaction. In addition, we can look to other incentives that have proven useful. For example, some states have adopted taxes on highly hazardous pesticides to disincentivize their use, which has led to some of the lowest levels of pesticide use around the world. These are just a few examples. I mean, there are many good examples, which I hope can help come through, because the situation is quite dire when we look at the totality of the impacts.
Mm-hmm. Yeah, absolutely. And so are there any lawsuits underway in which children and these vulnerable communities have really risen up to demand attention towards this issue?
Yeah, in fact, there are quite a few underway. There are some both within the US as well as in Europe around climate change, also in Latin America. The law firm that I'm working for now is actually representing communities, mostly children in some cases, who have been affected by lead pollution in Africa, for example, or coal mine activities and air pollution in Latin America. Litigation is, of course, a very powerful tool, sometimes the only avenue available to victims to get access to effective remedies. But it can also be a powerful tool in terms of driving the policies for prevention that we need. Certainly this mindset of a damage and sue approach to toxic chemical regulation that's in place in some countries hasn't been doing what we need to do in terms of both protecting human rights and protecting, in particular, the right to health.
Yeah. Thank you so very much, Faskoush. You made very important points on how to ensure accountability and also showing us solutions and policies of prevention that do exist. So thank you for that. And that ties in very well with the topic that will be addressed by our third speaker, Maria Fernanda Espinoza, who can add a global health diplomacy dimension to what we've been discussing today, and engage us further on children's rights and children's health in a global context. By way of a short introduction, she is a counselor of the World Future Council and co-chair of our Rights of Children and Youth Commission, member of the UHC Movement Political Advisory Panel, and commissioner of the International Lancet COVID-19 Commission. She has served as Minister of National Defense and Minister of Foreign Affairs of Ecuador. In 2018, Maria was elected as the 4th woman president of the United Nations General Assembly, the first woman from Latin America and the Caribbean to preside over this body since its founding in 1945. We are very pleased to have you today on the panel, Maria. Faskoush discussed the United Nations Convention on the Rights of Child and how children have been unjustly exposed to hazardous chemicals that bear lifelong impacts on their health. And so on this topic of children, and given your own work at the UN, I'd like to hear, Maria, what you think about the specific impact of the COVID-19 pandemic on children around the world.
Well, first of all, thank you very much, Hannah, and congratulations to the World Future Council to Alexandra, to Samia, to Annika, for bringing us together with such distinguished colleagues. They are the true experts, and I think we gather here today to discuss an issue of critical importance. I was truly shocked, to listen to Leo's data and information, and also to understand better, what are the implementation deficits in international children's law and human rights law regarding children that Baskud has so wisely brought to the discussion. And I think that we already said that, but I'd like to repeat that over and over again. The right of every child to survive, grow, and develop within the context of physical, emotional, and social well-being to each child's full potential. And here I am quoting a general comment number 15 of the Committee on the Rights of the Child. And this should be our starting point. I think that the United Nations, WHO, the entire system has constantly warned that in time of crisis, children are the most vulnerable age group. And I think that the COVID-19 pandemic has been no exception to that. So as all the experts might already know, but perhaps for our audience, we are told that children are less affected clinically by COVID-19 than adults. They are suffering devastating impacts, however, provoked by what it's been called the pandemic's indirect effects, non-pharmaceutic interventions adopted to mitigate and control the spread of the pandemic, such as, for example, school closures, social distancing, confinement, are increasing the vulnerability of children to human rights violations and harming their physical and mental health and their social and material well-being worldwide. In this sense, I think it is important to look at the impacts of the current public health policy responses to the pandemic on children, and also, of course, from a human rights perspective. For that, I believe it is useful to refer to the statement that I quoted at the beginning, the statement from the Committee on the Rights of the Child on children's right to health as an inclusive right, extending not only to timely and appropriate prevention, health promotion, curative, rehabilitative, and palliative services, but also to a right to grow and develop to their full potential and living conditions that enable them to attain the highest standard of, I don't know if you missed my voice at a moment.
No, you were perfect.
Okay, so I will continue because I had an announcement of weak connection, but great that it's working well. So I was saying that this holistic, comprehensive view of children's health regarding, looking at the underlying determinants of health, in addition to, for example, the exposure to chemicals and the very shocking information and analysis that we received already from Leo. So I think that this all-encompassing understanding of children's health from a child rights perspective is useful to better understand the specific challenges that children are facing due to the health and economic crisis caused by COVID-19. And sorry, I'm bringing the COVID-19 pandemic here because I think it sheds light to what are these structural determinants that affect children's rights and children's health. So I think that if we connect, just to follow up on the previous speaker, on human rights for children in terms of COVID-19, I think evidence shows that children are minimally susceptible to COVID-19, contrary to adults. They are less infected, they're reported to having milder illnesses, low morbidity, better prognosis, etc., etc. As in the case of adults, we know that, of course, this reality changes in case of children having, pre-existing diseases, and they are, of course, this group of children have a greater risk of developing severe symptoms. But of course, what is important here is poverty and income inequality increase the risk in children of contracting COVID-19. Children living under poverty lines are more vulnerable to the virus due to what you already mentioned, Hannah, at the beginning: poor housing conditions, overcrowding, lack of access to drinking water and sanitation, etc., etc. So in this context, basic preventive measures such as frequent hand washing and physical distancing are, in most cases, in these vulnerable communities and countries, are virtually unattainable. These children are also more likely to have limited access or no access at all to high quality healthcare, thus, of course, presenting higher rates of mortality. So to make the story short, the major impact of the COVID-19 pandemic on children does not reside on the virus itself, but rather on the threats that it poses on children's rights. The impact of COVID-19 on children have been disproportionate in terms of psychological, cognitive development, limited or lack of access to preventive and curative health services, food insecurity, sexual, domestic, and other forms of violence against children, specifically on girls. And let me very quickly address, so you have a helicopter view of what is happening between children's rights and the impacts of the COVID-19 pandemic. Let's look at the psychosocial and cognitive development first. School and childcare closures and mobility restrictions due to COVID-19 are really endangering children's present and future well-being. Home confinement has imposed immediate and lingering psychosocial impacts on children due to drastic change in their lifestyle and in their physical activity. And of course, due to school closures, 1.8 billion children are out of school as we speak. So children are losing more than education. They have been or continue to be unable to play or socialize outside the home, jeopardizing their emotional, cognitive, psychosocial development. Even, a short-term shutdown of schools and home captivity for children is troublesome and anticipated to have detrimental effects on children's physical and mental health. So as a consequence, and perhaps Leo can confirm that, in many countries, pediatricians, psychologists, and social workers are reporting increasing numbers of children and adolescents showing symptoms of anxiety, depression, as well as reduced quality of life. And, to add to this sad story, we have to say that the other big threat is food insecurity. According to UNICEF, schools play a critical role in the direct provision of health and nutrition services in the first 8,000 days of a child's life that are, as we know, are critical for their physical and intellectual development. Since the beginning of the pandemic, UNESCO estimated that 1.6 billion children worldwide were affected by school closures, nearly 370 million children not receiving a school meal in 150 countries. So these are really troublesome numbers. Malnutrition also leads to weakened immune systems, making children who are malnourished particularly susceptible to many illnesses, including viruses, of course. So there is also, a connection between food insecurity, children's rights, and the COVID-19 pandemic. And to add to that, the issue of increased levels of violence against children. And as mentioned before, among children, girls have a higher vulnerability to domestic and gender-based violence. Studies on the impacts, for example, of Ebola in girls' rights in Africa show that the loss of parental affection and care, financial deadlock, and school discontinuation increase the risk of sexual exploitation, teenage pregnancy, and transactional sex. Endangered girls had to, for example, undergo transactional sex for fulfillment to basic needs in exchange, like food, drinking water, shelter, raising at the same time the numbers of child and adolescent pregnancies. UNFPA, the UN Population Fund, estimates, for example, that 2 million additional cases of female genital mutilation could take place over the next decade, only as a result of the current COVID-19 pandemic. And that, of course, brings us to less access to health services. The pandemic is making a bad situation even worse, as countries that were unprepared, most of them, the majority of them, try to cope by diverting resources away from essential services. I think that the pandemic has also caused a scale down of sexual and reproductive health services, which affect primarily women and girls' right to health. So, the overall situation, it's not encouraging. Immunization campaigns were halted in several countries. They have left 3.5 million children unprotected against preventable life-threatening diseases. So, perhaps the golden bullet is advancing in the provision of universal health coverage. And I think that this is perhaps one of the greatest challenges, but also achievable. It is an achievable goal and target. I think that the first issue is the importance of a children's rights perspective in the design and implementation of public health policies and recovery plans. The second critical issue is the decades of rolling back investment in public health system and universal health coverage, which has been one of the main bottlenecks, especially in the global south, especially in low and middle income countries. So I think that to overcome these two challenges, the first in terms of a holistic approach to health and children's rights, is global action to prevent, to mitigate, and respond to the effects of the current pandemic and its consequences for children, and advance the achievement of Agenda 2030 and the Sustainable Development Goals, and of course of the implementation of the Convention of the Rights of the Child. The second issue is that national and local governments should guarantee children's access to education by prioritizing reopening of schools, of course, under safe conditions, and close the huge digital divide by connecting all children and young people to the internet. Half of the world that is not connected to the internet. The number three would be urgent action to guarantee access to health and nutrition services and make vaccines affordable and available for every child. And this is doable. There are so many billions and trillions out there that are being put in recovery packages worldwide. And fourth, national and international efforts focusing on bringing an end to gender-based violence and neglect in childhood. And of course, this comes with the provision of parenting support, child helplines, and other child-focused reporting mechanisms. Informal social service workers that have worked so well in so many parts of the world. The number 5 recommendation should, the need for governments to increase access to clean water and sanitation. This is critical on the universal health coverage formula, reverse the rise in child poverty, and ensure inclusive recovery to COVID-19. And last but not least, the importance of multilateral humanitarian support, especially to protect and support children and their families living in conflict situations, in disaster areas, and in areas of displacement. I think that this would bring perhaps an overall perspective. The key to this is the recognition of health as a global public good and a fundamental human right. This should be at the basis of what we do and our response in the provision of universal health coverage. I think that one of the key lessons from the COVID-19 pandemic is that the world needs robust, well-funded public health systems and universal health coverage as a key antidote, as a true stopper on any health crisis. I think that universal health coverage is absolutely crucial for achieving the Sustainable Development Goals. I think if we don't have a healthy population, it's very difficult to think about other rights and access to other public goods. A healthy society, I think it's a prerequisite for the eradication of poverty and the achievement of gender equality and the promotion and protection of the rights of the child, of course. So I think that this year, as World Health Day, the title was building, as you said very well, Hannah, at the beginning, building a fairer, healthier world. And in that, of course, it's a strong call for ensuring that everyone, everywhere can realize the right to good health. And finally, I think that we need to build, and we are given the opportunity to build forward better our multilateral system. Being better prepared against health crises and pandemics will only happen through global cooperation. And the dictum that no one is safe until everybody's safe is undoubtedly true of the current pandemic, but it also speaks to many other challenges facing the international community. So I would like to conclude by emphasizing that the COVID pandemic has proven to be a global challenge in which the rights of the child, in particular the children's rights to health, have not been adequately addressed. We have the opportunity to change course, of course. And in this sense, all-encompassing understanding of children's right to health has to be both in the mitigation measures against the pandemic and in the recovery plans, of course. I think that universal health coverage, sustainable development, human rights and human security, and therefore, our commitments to reach UHC, universal health coverage, by 2030, it's still a pending homework. And we are all co-responsible. We all have a very important role to play in global coordinated action, increased solidarity, multilateral cooperation, and not go it alone in nationalistic responses, as we have witnessed in some cases, especially, for example, in the access to the COVID-19 vaccine. I think that in the current circumstances, and listen to the two previous speakers, inaction is not an option. And we do have the blueprints to make it happen. The UHC political declaration from 2019 that happened, during my tenure as president of the UN General Assembly. Of course, Agenda 2030, the Sustainable Development Goals, and the entire, not only the Convention on the Rights of the Child, by the entire human rights international architecture. I really thank you for your patience. I think I spoke a lot, and back to you, Hannah.
That was so wonderful. Thank you very much, Maria. You made such important points on how children are impacted by COVID-19 and the measures taken in response to the pandemic, as well as your points about how health needs to be recognized as a global public good to lead us closer to universal health coverage. So thank you so much for that. And that really ties together well with what we heard from Leo and Bashkut earlier about the impacts of COVID-19 and how they might have amplified existing disparities in health systems, which were already severely endangering children's health, in particular for decades, due to risks stemming from endocrine disrupting chemicals. So thank you to all of our panelists. And by the way, I want to encourage the audience members to continue sending in questions using the Q&A feature of Zoom. We'll have some time at the end to try to get to as many of those questions as possible. But before we open up the floor to the audience, I want to do a brief roundtable with all of the panelists where I'll pose a question that all of you will have the chance to answer to engage us further on some of the topics that you all have brought up. So I want to actually build off of something Maria said at the end. Key public health lessons we can learn from the pandemic. It's been such a grueling year, and there's really no better time to hone in on the lessons learned than in honor of World Health Day. So perhaps we could start with you, Maria, again. What do you really see as the key lessons that we can learn from this pandemic?
Well, I would say several, but number one, that the best way to be prepared for a health crisis is to have strong public health systems and universal health coverage. When you see the very diverse way of and the response capacity of countries, you see that in most cases, not in all of them, but in most cases, there is a direct correlation between, strong health systems and the capacity to respond. Resilience building in the health sector is critical, but also investment. When I hear, it is very expensive. Universal health coverage, for example, it's very expensive. And I think it is much more expensive not to be prepared. And we are, watching, in first row, what are the consequences. A huge health crisis unleashed by a pandemic, a microscopic virus, has altered the entire global economy. The GDPs of all countries. We are living an incredible, recession moment, but we are also living a moment of reinvention, the opportunity to, as I call, build forward better, not build back better, but build forward better and learn from our own mistakes and our own shortages.
Mm-hmm. Great, thank you so much, Maria. Bashkut, I'd like to bring you in. Do you have any thoughts on what Maria said that you want to respond to, or what do you see as the lessons we should take away from this pandemic?
Well, thanks, Hannah. That's a good question to consider. I mean, I guess from my perspective, one of the main lessons that I think has already emerged from this pandemic has been the importance of elimination and elimination-based policies. So eliminating at the earliest possible moment the occurrence of these coronaviruses or other infectious diseases, which for the countries that took an early interventionist approach to eradicate the disease as quickly as possible, the disease caused by the coronavirus, COVID-19, the investment that they made seems to have been quite worthwhile. And I think that if we draw an analogy to the world of toxic chemicals, and some of the figures that we've seen, that a prevention-based policy is fiscally sound, and maybe Leo would want to elaborate more on that. But I mean, from a human rights perspective as well, as was mentioned by Maria, I mean, when we have inaction, when we don't take action, there's a ripple effect, and it spills over not just into health, but also into areas such as education and a child's right to maximum development, both physically and mentally in terms of their learning potential. It fosters conditions that can lead to violence, domestic violence, or other forms of violence that may emerge from communities that are wrongly being accused of causing the pandemic that we're facing right now. Yeah, so I guess I'll leave it there. But for me, the pandemic has just really reinforced the idea that as a human rights obligation on states, the element of prevention of exposure, minimization of exposure when it can't be prevented, is fundamental. It's fundamental to health and a host of other human rights as well.
Yeah, great point about the ripple effects of leaving a lot of these issues unaddressed. Leo, I'd love to bring you in as well. Perhaps you can share from either a healthcare delivery perspective or a public health perspective, what has struck you most about this pandemic and what you think the biggest takeaway should be.
So I think we think of a pandemic typically as an infectious disease, and in the case of the novel coronavirus. But when you take a step back to the primary forces that set in motion this pandemic and others related, I think of Ebola, MERS, you can continue the list. The role of the environment in setting in motion these pandemics is crucial, actually primary. Ultimately, when you see deforestation and climate change and the impacts that have on ultimately increased contact of pathogens with humans, you have the petri dish that brought us to the situation we are. And there are more of these pandemics likely to come if we do not address these primary environmental factors. And it's not lost on me that toxic chemicals that we've talked about and climate change have at the core a substantial common origin factor, and that's petrochemicals and the broad use of fossil fuels and their consumption. Ultimately, we need to steer back towards a more sustainable strategy on a host of factors, but especially there because there's so much interconnectedness. Ultimately, when we think of something that normally we think of as an infectious disease, but really we've been able to take a planetary health mindset, I think, away from this pandemic and its implications. I would just make one final comment and to say that chemicals actually may play a role in the severity of COVID-19. We saw one of the earliest studies linking long-term air pollution exposure with severity of COVID-19 infection. And more recently, the PFAS I talked about way back actually are well known to disrupt immune function, to be associated with increases in infections in young children, and most recently were associated with severity of COVID-19 itself. And that's because PFAS disrupt T cell immune functions that protect against viruses. So my key word is interconnectedness.
Mm-hmm. Yeah, wonderful. Thank you so much, Leo. And thank you to all of our panelists for all of your important contributions today, which really drive home the point that health needs to have a global approach, no matter whether we're looking at health hazards of chemicals or toxics, or of course, the COVID-19 pandemic. Our challenges today are global in nature and hence need global problem-solving policies and approaches. So on that note, I would like to turn us over again to Alexandra of the World Future Council. Alexandra, can you perhaps share when the winning policies will be announced for the Future Policy Award and what will happen after the announcement of the winners?
Yes, so our jury has decided to select top candidates for the award as well as winning policies. So the top candidates will be announced at the end of May in the run-up of World Environment Day. And then the winning policies will be announced in early July. And then also shortly afterwards, we will have a virtual awards ceremony, which we're currently preparing. And so we'll be very happy to invite you. So please stay tuned. You will get the information on our website or also on social media. So we'll be very happy to keep you informed on that. At the same time, I also wanted to mention that we have been awarding also policies on other topics that are relevant to this webinar on health. So we have, for instance, awarded policies on the rights of children, how to protect children from violence, how to ensure the right to food, which is critical also for the rights of children, how to protect biodiversity in the best way. This is also critical in order to prevent pandemics. And so these information can be found also on our futurepolicy.org website. And also we will have another webinar coming up. The next one will be actually on biodiversity. And I want to mention that because Leo mentioned also the importance of the environmental factor and that we need to prevent pandemics. And therefore we will be addressing this topic specifically at the next webinar, which will be on biodiversity on the 20th of May. Thank you.
Perfect. Wonderful. Well, thank you for that. And I want to give us as much time as possible to get to our wonderful audience questions. So let us see what we have here. We have a question from Nadine Hawkson, who asks, how do you think countries can circumvent the derailment of healthcare services delivery during the COVID-19 pandemic, especially for those of non-communicable and neglected tropical diseases? Perhaps I'll turn that question over to Leo.
Sure. So, the pandemic has been disruptive, but disruption sometimes provides the seeds of change for the good. And we've seen, even in New York City, the adaptation of healthcare practices into remote and other formats for clinical care. Even in my own research, we've adapted to remote data collection and other creative pathways to get the job done. And the conventional model of old school going to a clinic or going to someone's house to do assessments is completely gone out the window. And I think that's for the long term and for the greater good if it's done correctly. The digital divide is a huge problem. It needs to be addressed. Otherwise, what I've just talked about will widen, not narrow disparities. And as someone who works at Bellevue Hospital, the flagship of the public hospital system in New York City, I can speak to that quite directly. So it's by innovating service delivery models and frankly, all aspects of public health that we can actually address not just infectious diseases, but non-communicable diseases. So much of chronic disease prevention ultimately is about behavioral change, coaching, educational interventions that don't need the in-person touch. We all know that we crave that as human beings on this planet. So I'm not saying there isn't a role for that, but in the context of situations like this that may arise again in the future, we should be prepared to adapt accordingly and maximize our reach to those who most need it, especially in rural settings where in-person visits just were never, frankly, that feasible.
Mm-hmm. Yeah, thank you so much, Leo. We have another question here. Do you think that the pandemic will make it easier to introduce relevant healthcare reforms or harder? Perhaps, Vishku, you can answer that from a legal perspective, if you think maybe there's a push now to address some of these issues and really implement these policies.
Well, yeah, thanks. I think maybe if we could switch a little bit from environmental health to occupational health, there has certainly been a push from unions and other labor activists for universal or global recognition of occupational safety and health as one of the fundamental principles and rights of the ILO. Surprisingly, at least surprisingly to me, it is not one of the fundamental principles and rights. There are 8 or so, and that's not one of them. Occupational safety and health is a globally recognized human right, but not in the world of work, according to the ILO. So this pandemic, I think, has really reinforced the need for this to be one of the ILO's fundamental principles and rights at work, but also to be truly treated as and respected as a human right, both by businesses and also by states around the world.
Mhm. Wonderful. Thank you so much. And thank you all of our audience members for all these questions. We'll try to get to as many as possible, I promise. We have one from Catherine Austin who says, hi from the Netherlands. I was wondering, where do you see the differences between the global North and the global South regarding the implementation of universal healthcare? Maria, maybe you can take that one.
Sure. Well, let me unmute myself first. You know, there are several assessments on universal health coverage that is worthwhile looking at. There is the UHC Service Coverage Index of the World Bank, but there's a series of studies and analyses from the movement that I have proudly, you know, a political advisor to, which is UHC 2030. And they have made, you know, country profiles, state of UHC commitments, reports. There is a UHC tracker, et cetera, But basically, what the information we have so far shows is that in general terms, you know, the higher income a country has, their response to universal health coverage is better and their health systems are better. This is, of course, in general, but we have, you know, good and bad exceptions. So the North-South divide sometimes doesn't not work. For example, countries like Comoros, like Cuba, like Zimbabwe, do have very, very strong, you know, public health systems and are doing pretty well in universal health coverage. And you have countries from the North. I wouldn't tell you the names, but they are on the studies, but they're not doing well. And there is a direct correlation in the preparedness and response capacity of these countries to major global crises such as this pandemic. And I think it is really not easy to just draw the line and say richer countries do better, poorer countries do worse. It doesn't happen. You know, this is we should look more carefully at the indexes and the reports from UHC 2030 at the World Bank UHC service coverage, and you know, to look at the 3 areas. Some countries do well in one area and others less good in the 3 areas of universal health coverage: service delivery, health financing, and of course issues of governance, transparency, accountability, etc. And I think that civil society engagement on this issue in terms of accountability, in terms of oversight, is extremely important. And that's why movements like the UHC 2030 movement are so important.
Mm-hmm. Thank you so much, Maria. We probably have time for one more audience question, which is, can you estimate how many children are exposed to toxic chemicals worldwide? Leo or Bashkut, you can jump in on that one.
I would argue, I don't think we have data to confirm, that there is no child in the world who is not exposed to a substantial body burden of toxic chemicals that impairs their health. the estimate of the number of chemicals remains this bizarrely moving target. It's anywhere between 80,000 and 200,000 chemicals if you take the latest estimate, with hundreds, if not thousands, of chemicals introduced into the environment each year. We've made the assumption at some points that rural, low and middle income country populations were not exposed. That's turned upside down now. By 2030, the OECD estimates that the majority of toxic chemical production, I should say chemical production and consumption, will be in low and middle income countries, suggesting that there really is no pristine environment. We've seen data from the Antarctic telling us that there are PCBs and even PFAS deep in the archived ice samples that are extracted from history. So we just have got to reset our minds in alignment with the science. Science constantly evolves and has told us that this is a real problem and not just something imagined or otherwise, despite some substantial interests arguing otherwise.
Mm-hmm. Great. Bashku, do you have any thoughts on how to really assess the scope of exposure for children?
Well, I mean, there are some interesting initiatives taking place, especially in Europe, a human biomonitoring initiative that's taking place, which I think can help to shed some light. But as Leo mentioned, it's pretty difficult to envision any community of children anywhere in the world that is not exposed to some man-made synthetic chemicals. Even in the Arctic, we find children with these synthetic forever chemicals or PFAS chemicals that were alluded to before. We have DDT that is still circulating in the environment, both from current use as well as from historical uses, as well as the interlinkage between climate change and toxic chemical releases, where some of these chemicals that were phased out many years ago have been frozen in Arctic permafrost that is now being melted and remobilized into the environment and recontaminating food sources and other means of exposure. So yeah, so I think I can leave it there, but it seems very difficult to say that any child is not being exposed to toxic chemicals today.
Mm-hmm. Thank you for that. And actually, I think we have time for one more audience question, which I will throw to Maria, which is, some argue that universal health coverage is a massive financial burden for many countries. Is this true, and how could that be addressed?
Well, I think that the best investment that you can make is to have, a healthy population, a healthy society. And that does not include only, the strictly medical therapeutic approach, but the overall concept of health as a global public good, as a human right. And I think that if you do not have a healthy society, it is impossible to think about democracy, about prosperity, about even, reconciliation between our societies and the planet. I really like what Leo said on a planetary mindset. And I wouldn't say it's a burden. It is an obligation. It is a human right. And it is the best investment. And I think that the examples are out there. Leo connected the issue between, the costs in our GDPs because of the exposure of children to toxic chemicals. So, the best investment is to avoid that. And for that, again, to look at a new social contract between society, the economy, and the environment, and politics, of course, is basically what I feel in the making right now. You know, we have suffered, we have lived, you know, a year of losses, of hardship, but this has given us the opportunity to build forward better. And I think that the Global Policy Award, the work of the World Future Council is so encouraging, you know. It brings light to say, yes, there are good policies out there are good practices out there, there is a possibility to really take decisions that are transformative, that are improving the quality of life of children worldwide. I think that that's the importance of the policy award from the World Future Council, is to show the world that a transformation is possible. And here we are given the opportunity to work on this new social contract, in this reconciliation between human societies and our planet and nature. This is going to be a very critical year for this reconciliation, as the UN Secretary General says, and I love that phrase, we need to make peace with nature. And you know, the upcoming COPs this year, the Climate COP, the Biodiversity COP, the Desertification COP, the Oceans Conference, the Food Systems Conference, it's all happening this year. So we have this opportunity to recommit ourselves to a more sustainable way of life. I think that that's what I would say. The best investment, invest in strong, solid, efficient public health systems and health for all.
Perfect. We have one question that someone really wants answered from Bashkut, which is, what is the need to strengthen the CRC towards the right to healthy environment free from hazardous chemicals? Bashkut, maybe you can offer some insight on that.
Yeah, well, thanks. Well, I think if I understand the question correctly, I mean, the need to strengthen the CRC, in my view, is a need to use it more. The CRC should be something that every state is considering when they're thinking about or developing or implementing any environmental policies across the board, any policies related to consumer products that contain toxic chemicals. The guiding principle, one of the guiding principles of the CRC, is to take the child's best interests into account in any policy or administrative decision-making processes. And so in using that at the national level or even the regional level, for example, in the EU, I think there's a lot of potential with the Convention on the Rights of the Child to drive policies to a more protective place. But also there is the ability to use the mechanism of the Convention on the Rights of the Child, the UN Committee on the Rights of the Child, as a vehicle for also holding those to account that aren't upholding their obligations and responsibilities under the UN Convention. So perfect. I hope I understood the question correctly. Two ideas there.
Wonderful. Thank you so much. Well, we are approaching the conclusion of the panel now, so we can just do a quick concluding round of takeaways from all of the panelists. 2021 has been a critical year, as we've discussed, with the pandemic, which has really put a whole host of health issues at the forefront of attention. So based on each of your areas of special expertise, perhaps in a sentence or two, you can just share what you think the measures need to be taken by policymakers are in 2021. We'll start with Bashkut, and then we'll go to Leo and end with Maria.
Well, thanks. I think one of the measures that really needs to be taken by policymakers around the world, at any income level of country that we look at, is a focus on injustice, environmental injustice, looking at the inequalities, which I think the COVID crisis has really brought to the fore over the past year or more, and in looking at policies that can actually tackle these injustices and make sure that everyone has the right to a healthy environment, which is a precondition for the right to health or any other of the many human rights that are implicated by our environment.
Great, thank you. Leo?
So we've talked already about climate change, though that's not the focus of this discussion. And it's no secret that climate change has, in the environmental space, in the global movement, substantial attention. But I think we can take away here that even if we cool the planet and tackle climate change head on, if we leave behind a population and an environment that is contaminated by the toxic chemicals we've talked about, we will not be able to sustain our future in a healthy or productive way. And so we really need to align the movements that might otherwise seemingly be disparate and think in a broader framework about protecting children.
Mm-hmm. Great. Maria?
Well, I would perhaps say three things. One is that the recovery packages, the COVID rescue packages should consider as a priority to invest in robust health systems that are resilient, that are well prepared. The number two would be to also consider and invest as one of the greatest investment in gender equality from an intergenerational perspective. I think we haven't had the time here to address the challenges for the younger generations in general, for children, but also for youth. So there has to be an affirmative action for investment in the recovery from this intergenerational perspective, gender equality and the rights of women and girls in particular. And third, and I would say this could be perhaps thought as the umbrella, we really need to think seriously about the need of a new social contract, of a global commitment on between our economic and material needs, our planet and our planet's health, and the decisions we take, the policies we prioritize, the good practices. And the World Future Council has a great experience for several years on that. And I would close by saying that this, of course, is prescriptive, but cannot be possible without the engagement and full participation of society, all sectors. It has to be a cross-sectoral effort, a civil society effort, a private sector effort, government's effort, of course. And for that, we also need a strong, a vital, rejuvenated multilateral system. This is also critical, based on cooperation and solidarity. This is also critical. Thank you, and back to you, Hannah.
Wonderful. Thank you all. And that concludes our webinar for today. I want to extend a deep thank you to all of our panelists, Leo, Bashkut, and Maria, for their generosity with their time and their insight. And I also want to thank, of course, Alexander Wandel for helping frame today's discussion. To all of our cherished participants and listeners who joined us here on Zoom and also on Facebook, we thank you for your time and for listening. We hope you will be ambassadors for successful health policies in your own communities and remind your leaders of the need for healthcare, because health is the foundation of thriving societies. Thank you all for being a wonderful audience. And finally, I want to acknowledge the wonderful staff of the World Future Council for all of their work in making today's webinar possible. We have Miriam Peterson, Anna Laura Sten, Annika Weiss, and Samia Kasid, and all of the staff of the WFC who have contributed to making today a success. Thank you all for your efforts and dedication. Everybody, please follow the WFC social media handles on Facebook, Twitter, and LinkedIn for subsequent sessions of the Forward Thinkers webinar series. On the website, we have a lot of knowledge and policy solutions for our common future. So check that out at worldfuturecouncil.org or futurepolicy.org and get inspiration on how to create a better world for current and future generations. Thank you all once again for joining us. See you another time. Enjoy the rest of your day. Bye.
Thank you.